record this meeting and send it out after. My name is Claire Paprocki. I am the Public Information Officer for Brown County Public Health. It's my pleasure to share with you today. We have two guests joining us. We have actually three guests joining us. We have Brown County Executive Troy Struckenbach. We have Dr. Ashok Rai, President and CEO of Prevea. He's going to share some information and data from the two community test sites. And we also have public health nurse Erin Bongers from the Depew Health Department, who will explain what's involved with contact tracing, which is an important component in our efforts to stem the tide of COVID-19 in Brown County. So first, I'm just going to run through the numbers. Brown County currently has 1,911 confirmed cases. Oneida Nation is reporting out 22 for a total of 1,933. There are 40 individuals who are hospitalized. We have 283 individuals who are out of isolation. On Saturday, the Risk Center was able to conduct 165 tests. Casa Alba conducted 110 tests. So far, for the total between the two testing sites, we have been able to test 3,321 individuals. Unfortunately, we did have 5 more deaths come in over the weekend. We had a 97-year-old male from the zip code 54313, a 92-year-old male from the zip code 54304, a 76-year-old female from the zip code of 54162, a 62-year-old male from the zip code 54162, and a 77-year-old male from the zip code of 54304. I will now turn it over to County Executive Troy Struckenbach.
Good afternoon, everyone. Appreciate the opportunity to once again discuss the response and what's happening in Brown County, particularly, just our efforts as a community to address the issue. I think it's fair to say that we're very fortunate to have community health providers in Northeast Wisconsin. Specifically, we have today with us Dr. Rai from Prevea, but we also have Aurora, we also have Bellin, and the St. Vincent, St. Mary's hospitals. It's very comforting knowing that you have the willingness and the ability to address these issues in our community. And I can tell you with, as a county executive, from the very get-go, Dr. Rai has been outstanding in terms of the response, the communication, really kind of working and helping, both public health, myself, better understand some of the things that we need to get in front of and top of. The reality is that you can never be completely prepared for this type of event to take place, but it's assuring knowing that you have community partners working with you to best manage it as best as possible. So it's great to have Dr. Rai on here. I think he's become, kind of the voice in terms of the medical community on, just better understanding as an individual resident and a community member for Northeast Wisconsin. It's certainly a trusted voice that Dr. Rai and I have talked over weekends on just, things that are popping up that we need to, immediately get to work on. So I'm glad he's here to give us some advice. We all really, truly appreciate his efforts in here and what him as an individual community member, but also as an individual part of the healthcare community. And I know Dr. Rai will state that while he works and is part of Prevea, he really is trying to represent the healthcare industry in terms of that community collaboration. So Dr. Rai, thank you for joining us today. And we all look forward to hearing a little bit what you have to tell us in terms of the testing.
Thank you, Troy, and tuning in today. I think there's some echo feedback. Hopefully that doesn't continue. Thank you. So I want to reiterate Troy's thanks to my fellow health system leaders at Aurora, with Dan Meyer, Chris Waleski at Bellin, and Brian Charlier at St. Mary's and St. Vincent's for the partnership and the collaboration we've had in town. I don't think people understand that for the last 2 months, we've been meeting daily and communicating throughout the day to help public health in partnership in our response to the current pandemic crisis. One of the roles that we were asked to play in partnership with the county, the state through the National Guard, was to assist with countywide testing. Every health system was testing up until that point and continues to test. But in a collaborative effort between all the systems represented with the National Guard and Brown County Public Health and other entities, including fire, the city of Green Bay, police, the county sheriffs, everybody partnering together to really take on a huge lift in this testing. I was asked to share some of the data that we have, and please understand, I'll put a caveat here, that the data is in our electronic medical record and we're trying to get it out as quickly as possible, but we can do that as it's updated at midnight every night. So my numbers aren't exact to what you've heard. And the data that we have in front of us is everything that we've been doing in partnership since the previous Thursday when we started testing for some of the discrete employers. So our total number of tests is a little higher than what the county just pointed out in the number of tests, just because of the way we draw our data out of the system. Also, a couple other small county projects are embedded in here. But to kind of give you the scope of what's going on with testing, so far in partnership with the systems in the county and the Guard, we've tested 4,445 individuals. So far, we've gotten results back on 2,971 of them, and 254 of those results have been positive. You may ask, what's the delay in resulting? And I just want to explain that is obviously we get the test and now that needs to be sent to Madison. There's a computer system interface that needs to be in place, which is actually moving a lot faster today than it was maybe last week as things have gotten smoother throughout this time, but we still are working on calling all of the individuals back. So there is a little bit of a delay in there, just given the volume and number of tests that are coming through. Our goal is, number one, to contact those who are positive immediately, or as soon as time allows for that. That has to come from a provider. So a Prevea provider will call you and give you that result. And then the negative results are called by nurses and other people in our nursing pool, and we continuously do that. Just because you haven't gotten a call doesn't mean that you're negative. It just means that we're working through those result pools. So I want to make sure I clarify that. Another interesting point is that we've had people without symptoms come to the testing site. A large portion of that came through because of the partnerships with the employers that were being tested right away because there was close contacts. But overall, 2,014 people have been tested that did not list a symptom, and of them, 57 were positive. So I wanted to share that with all of you today. We will continuously get data as the testing is updated, and hopefully it'll continue to be faster in our response rate. But right now we still are saying, to wait 5 to 7 days for that test result. Obviously that number is going to continue to narrow down as we continue to perfect this process. But understand it's been a great partnership with the National Guard, who's also helped in transporting at night, the county, and everybody is associated with that. And once again, I just want to thank the other health systems for their participation and their help as well. One other question that I wanted to make sure I addressed before I turn it back over to Troy was the ages that we're testing, and we actually are testing all age groups coming through, and the testing has been expanded today for those that are essential workers living in Brown County or working in Brown County with or without a symptom. So we want to make sure we clarified that as well. But understand that the National Guard will not test anybody under the age of 5, but we have healthcare nurses on board from all systems at the sites to test anybody under the age of 5. So age is not a restriction for testing right now. So that being said, I will turn it back over to the county.
Thank you, Dr. Wright. We appreciate that explanation. And as you heard from Dr. Wright, the numbers are fluid as far as when those numbers are being reported from the state through the systems. And we try to give you as best as possible a snapshot in time, recognizing that in the next few hours, those numbers could change. And so from that perspective, we realize that there's, on the one hand, we need to do our testing, and that's something that we've been asking for, for quite some time, and we're very fortunate that we have the testing now available. And as you've seen over the weekend, the testing candidates have been opened up to now essential services that are asymptomatic. So that opens up a larger population pool for testing to take place. Keep in mind that both the rest center along with the Casa Alba location, there are available slots for individuals who are interested in getting tested. We would encourage everyone who feels that they need that test to get the test. It's one of our best ways for us to immediately be able to identify within our community how prevalent it is in our community, but it also gives us an opportunity to do the contact tracing. And I know there's been some questions in regards, how does contact tracing work? What's the timelines on it? And ultimately, what are we trying to accomplish? I think it's safe to say that our goal, of course, is to track down as many contacts as possible to, determine the risk factor and then make recommendations in terms of what that individual should do. I'm joined today with, from the City de Peers Health Department, Aaron Bongers, who's going to talk about contact tracing and investigation. What is it? How does it work? And why are they doing it? So with us is Aaron. Aaron, thank you.
Thank you, County Executive. We know that people are interested in the contact tracing and investigation, what it is, how does it work, and why we're doing that. So hopefully I can shed some light on you for that today. We're doing the contact tracing and investigation to mitigate the spread of COVID-19 in our community. When a test comes back to us and the patient is positive, that's when we start our role in public health. We reach out to the patient after they've been notified by their healthcare system, and then we talk to them about who they've been with, where they've been, or any possible contacts they may have had. Based on that initial discussion, when we start reaching out to the party, we talk about possible family members also, or roommates or the like. So basically we reach out to anyone who may have had a prolonged contact in an enclosed space with the individual. This is a process that can take several days and can take even several weeks depending on when we are able to reach the people. We provide them with a lot of different information so that they know they've been exposed to COVID. We also ask them to self-isolate and monitor for symptoms per the DHS recommendations. So if they become sick, then we have them reach out to their healthcare provider. So those are the basic steps that we take when we are informed of a positive case on contact tracing.
Thank you, Erin.
Thank you.
We will now open it up for questions from myself, Erin, County Executive Struckenbach, or Dr. Rye. If you could please introduce yourself and the news outlet you're from, and then just whoever you're directing the question to.
Hi, Rob Sussman, WTAQ. My question is for Dr. Rye. How are COVID-19 deaths being marked? I know that in a lot of situations you have people with comorbidities. How do you determine whether or not a COVID-19 death is indeed a COVID-19 death?
We use our clinical judgment in each one of those situations. Obviously, a COVID-19 positive patient that passes away will likely have comorbidities. But when we look at what actually caused that death, we know the acceleration of those comorbidities happens through COVID-19. So if we have a positive result, that's going to be part of the death certificate, as are other aspects that could be involved in that death. So it's not a sole diagnosis when we do that type of death certificate. If COVID-19 wasn't proven in that patient, and that's really a now situation. There's no reason not to test right now, Rob. But if we're talking about 2 months ago when we didn't have testing, there may have been a couple situations where it was presumed or thought about. But really, in today's world, now that we have testing, as the county executive just pointed out, it's a COVID positive test that we would use before we'd put that on a death certificate.
Mackenzie Amundsen from WBAY. Also a question for Dr. Rye. I know that originally when it was community testing just for those with symptoms, it was obviously recommended those people get tested and then go back into isolation while they waited for results. Now that it's open to essential workers who maybe aren't showing symptoms but could still have the virus, are they being told to go home? Are they good to go back to work? How is that being handled with some of these people that are just getting tested but not showing symptoms?
That's a great question, Mackenzie. You know, right now, if you are asymptomatic and, you know, once again, that's, you know, going through that entire CDC list of questions and you don't have a fever, there's no reason to be isolated just because you were tested. Now, if you turn positive, then there's an isolation protocol. But once again, if you are symptomatic, though, you should be isolated until that test comes back.
Kind of building off of that question a little bit, once again, Rob Sussman, WTAQ. Some of these asymptomatic patients that are coming in, are there situations in which they're never developing symptoms?
Rob, most definitely. There is and we don't know the exact percentage right now, so please understand that, you know, it's a novel coronavirus. We're learning every day, so my statements could change tomorrow as research comes out. But we've had people that have been purely without symptoms and have been positive and have been known to be positive, not only in Brown County, but in other communities. If you actually look through the numbers I was looking, just talking about, just slightly under 3% here, but it's also a very small sample size. It's only, you know, 2,000 people, which may seem like a lot of people, but when you look at the overall population of the United States, it's still a pretty small, you know, sample size. So we really don't know the percentage of the people in the community that may be walking around or transmitting COVID-19, and that's why those precautions are so necessary. When we talk about physical distancing and masking, till we understand asymptomatic transmission better. We know it's happening. We've known it's been happening here in our community now for well over 6 weeks, or when we first saw our first asymptomatic positives that we somewhat found incidentally.
Are there any questions for Aaron, Dr. Rye, executive?
Yeah, I have a couple of more. Can Erin spell her name first and foremost?
Sure, it's ERIN, and the last name is BONGERS.
Okay, fantastic. And then Aaron, I actually had a question for you. You had mentioned with contact tracing, prolonged contact was a term that you used. How is prolonged contact defined?
Well, what we're seeing is within 6 feet and for about 10 minutes or longer. So at least 10 minutes and within 6 feet is what they're guiding us for prolonged.
Not necessarily then say a checkout cashier.
No, not necessarily. Again, we're just going by the guidance that the DHS has given us, and they have said in a closed space or inside that if they're within that 6 feet for at least 10 minutes or longer and they don't have masks on.
Once again,
County, Doug Schneider from the Press Gazette. Just wanted to make sure what our total was in terms of total deaths with the 5 new ones. It sounds like there was some confusion over the weekend as to where our totals were.
I'm not sure what you're asking, Doug. Confusion about what? There were 5 deaths that came in over the weekend, bringing our total to 18.
18. Okay, thanks.
how is the county doing in terms of contact tracers? I know that on a state level, they're asking for more. How would you say that the county is doing in terms of staffing?
mentioned that in the beginning, we took a number of staff who were within the county and have trained them to become contact tracers in the very beginning stages. And with the case counts that we had coming in, that was manageable. A while back when we began the initial meetings with the healthcare systems, the National Guard, the CDC, once we started seeing the outbreak begin, we then made a request through DHS for additional help in the contact tracing along with the National Guard. And so I know that we have roughly in the area of around 40 individuals who work for Brown County. I know the Medical College of Wisconsin have helped out. There's a number of other agencies who have been helping here locally, but we're also referring a number of the cases to the state for additional help to be able to handle the increased caseload that has been happening here in Brown County.
Yes, thank you, County Executive. And we too at the City of De Pere have trained about 20 of our staff in the city to help out with contact tracing as well. And utilizing St. Norbert College has some nurses there as well that have been helping us with that. Thank you.
Mackenzie Amundsen, WBAY. Question for Aaron. With the contact tracing, is it difficult to get in touch with all of the people? Like, are you finding that lists are long? Are people following Safer at Home and having a relatively short list? What is it like trying to get in contact with the people you're reaching out to?
That's a really good question. It's been lower numbers, which is great. We know that the Safer at Home is helping. Most of our lists are shortened lists. We've been able to get a hold of pretty much all of our contacts. It's been difficult because some people don't want to answer their phones necessarily, because if the phone number is an unknown number, they're not sure who that's calling. So that's a great thing for people to be aware that if they see an unknown number come up, that might be public health trying to contact them to get in touch with them. We've also utilized texting as a resource, and any way that we can exhaust every mean that possible to get in contact with those individuals, we will. And we've had a really good success doing that.
Yeah, I'd like to reiterate that one of our only, there's a couple minor frustrations, but people not picking up their phone when we're calling, because kind of the order of what happens is, the positive result gets called by the healthcare provider, which for the county in this specific case is us, and then public health will do the contact tracing after we've informed them, but people not actually answering the phone. I personally have been involved in some of the calls in the evenings, and getting people to answer their phone these days has been a little difficult. So we do have a reminder now as they come through the testing site. They're given a sheet of paper to talk through, the instructions that they'll go through and to answer their phone when we call.
Any other questions for Dr. Rye, Aaron, County Executive Troy, or myself?
Yeah, for Dr. Rye, it's Doug at the Press Gazette again. We talked way back when about how the response was going to play out. And you spoke of a battle metaphor that we weren't ever going to go up in or give up on. How is the battle progressing in your eyes? Are we winning? Are we holding our own?
Doug, there's a couple different metrics you can look at. I think there was, obviously some concern when we saw what was happening in Brown County when we had some specific hotspots. But if you actually look at overall hospital utilization, hospitalization rates, and our success rates, I would say we're continuing to win this battle. The biggest part of winning that battle, as Executive Streckenbach mentioned, was, testing. I've said that since day one, right when I did my first media interview, and I've said it, I think, every single one, is for us to be able to stay ahead of the situation. Testing people, finding out who's positive, giving good isolation instruction, having great contact tracers like we have on the phone with us today, those are all the necessary pieces. One of the missing components throughout this has always been the testing component. And that's why it's been so great to have this partnership and to be able to really take on testing at a bigger level to jumpstart. And testing's not going to stop when these county sites, might, decide to, turn it back over to healthcare. But it definitely gets us a jumpstart. So those of us in healthcare can continue that momentum probably for a very long time.
Care to venture a guess on how long a long time would be?
Yeah, the minute that left my mouth, I knew you were going to ask that, Doug. No, actually, I don't know. And I think what's so important is that no scientist, no physician can give you a date at this point. So we must prepare for the future. We must learn to coexist with the current situation, design our processes around that, design our lifestyles around that. And we hope for a better situation going forward. We know it will come at some point, but it's literally impossible to pick a date.
Mackenzie Amundsen, WBAY. Again, probably for Dr. Rye or Claire, just talking about the community testing. I know that is expected to be turned back over to healthcare after Saturday. Expanding the pool to essential workers today. We had some viewers over the weekend saying they'd love to get tested, but they don't have any symptoms. Do we foresee the community testing being open to asymptomatic, just general members of the public if they want to be tested?
Mackenzie, I think we're going to follow DHS's guidelines on that. And right now, that's what the county is doing. As they got the DHS guidelines on Friday, they expanded it to essential workers. So we definitely have to follow the state's, roadmap on this. And at this point, general asymptomatic testing isn't on that roadmap, but they have lowered the bar pretty significantly when it comes to symptoms or if you've been in contact with somebody who's positive. So I think a lot more asymptomatic people will be tested, but to say it's going to go carte blanche, everybody come on in for a test. I don't think that DHS has given that recommendation at this point, and that's what we're going to follow from a healthcare perspective.
Yeah, we would echo that, Mackenzie. Hearing no more questions, I'm going to turn it over back to County Executive Troy. He wanted to make a statement.
So I appreciate everyone's time again in this discussion as we've focused on the last week and into today is about the increased testing. It's about bringing in community partners. It's about talking about the impacts on children. Going into the rest of this week, we're going to start looking at what is the realities of us being able to reopen up parts of our economy, and what is that going to look like? As you heard from Dr. Rye, things are not going to immediately just go back to normal. We're going to probably continue with lots of testing taking place, and it really comes up to us as a community. I mean, really, from that standpoint of, I can't stress enough about the importance, at least right now, to be making sure that you're wearing a mask when you're in public. Continue to do the social distancing. Try to keep 6 feet apart. Maintain that family, unit as far as not coming into contact as much as possible with others. As you heard, things are changing every 24 hours. In Brown County, we realized by having the fourth largest county, third largest economy, it was natural for us to have the numbers in this area. We do have a very large agricultural industry. Roughly about 12% of our population or our workforce is in the agricultural industry. And so needless to say, it's really important for us to be able to get ahead of this, that we continue to follow those recommendations that are being provided by both our healthcare providers, CDC, DHS, and our local public health. That's one way for us to win this. Second thing is, of course, the increased testing. We saw that where testing was made available early on, they were able to put a hold on the outbreaks in their communities. We're very fortunate to have the testing that we have now available. I would encourage everyone to reach out to their employers if they believe they're in an essential business and request to get onto the testing. those sites are available on stayhealthybc.com to sign up. Lastly, I have behind me the Keep On Wisconsin. There's a campaign going on right now in this area and the state of Wisconsin to talk about the, how do we inspire as we're coming into, I don't know, 50 days into this. I realize that, a lot of businesses, a lot of individuals in our community are struggling. And it's important for us to keep that positive attitude amongst ourselves. We will get through this. I'm confident with the strength of our healthcare providers that we have in our community, such as Aurora, Bellin, and Prevea and HSHS group, that we will make it through this. But it's going to take a community to make it. And I just hope that all of us continue to listen to the healthcare providers, keep on Wisconsin, and let's make it a better community. Thank you.
Thanks, everyone.